Are you experiencing pain in your heels? Or maybe it's your ankle that's been acting up. Well, foot and ankle care is vital as it affects the foundation of our bodies. And Dr. Michael Wolf is a doctor of podiatric medicine at the University of Michigan Health West, and he joins us this morning to share some important information on how to care for our feet and ankles. Good morning, doctor.
Good morning.
Thank you for being here. So I alluded to it at the top of the segment. It's pretty important to take care of our feet and ankles. I mean, they carry us around.
Yes. I mean, it's the foundation, for your whole body. So obviously it's so important just for the overall mobility. So having good, healthy feet is super important just for your overall health. I was a cross-country runner growing up, which is kind of what steered me into podiatric medicine, just because I understood, like, hey, I got to have good healthy feet so I can stay mobile.
Well, as a podiatrist, what are you seeing the most of? What are people complaining of?
The most common thing that people come in for is what we call chief complaint is going to be heel pain. And I would say 90% plus of the time, it ends up being what we call plantar fasciitis.
Plantar fasciitis?
Yes.
Okay, I'll be honest, I've heard that term. No idea what it is.
Yeah, fair enough. So your plantar fascia plantar fasciitis is just inflammation of your plantar fascia. Your plantar fascia is a strong ligament that essentially goes from your heel to the ball of your foot. And it does have three different slips, essentially. You have a medial, central, and a lateral band. Okay. So yeah, that's your plantar fascia, and it's the inflammation of that ligament.
And what does that feel like? So you're hearing people is it heel pain? That's what you feel first?
Yep, it's heel pain. First thing, usually what their patients are saying is, I get out of bed first thing in the morning and my heel is hurting me. After about 10, 15 steps, it does get a little bit better, but never goes away. And then if I sit down later on in the day and then get back up, those first handful of steps, boy, are they painful. It's usually kind of this like sharp stabbing pain in the heel.
If anyone watching right now is suffering through that, you definitely want to pay attention because this is something that can be treated. Now, you mentioned you were a cross-country runner.
Correct.
Is it running? I mean, what are the risk factors for getting that?
There's a lot of risk factors. Foot structure is a big one. Whether you have flat feet or a really high arch foot, both of those can cause stress on your plantar fascia. A real big one, though, that people don't fully understand, though, is actually it's a tight calf muscle. That's going to be the big one. What it ends up doing when you have a really tight calf muscle, and what we call it is equinus, having a tight calf muscle.
Okay.
And what that ends up doing is it causes a couple of the joints in your foot to act a little different to make up for that tightness, and then that puts even more stress on your plantar fascia. A
little compensation just makes things worse, right?
Exactly.
So when it comes to treatment, how do you treat this?
The big thing is going to be stretching. That is if it's a tight calf muscle. So that's one thing we're going to look at in clinic. Good shoe gear is going to be a big one as well, with good inserts. What the inserts are going to do, it's going to help to put it's going to obviously support your arch, but it's going to help to put your heel in a good position to kind of limit that compensation to then put strain on that plantar fascia.
Excellent. And of course, that's how you treat it. How do you prevent it? Is there a way to just avoid it at all costs?
It's a tough one to prevent because some people are just going to be prone to getting it. Stretching, especially if you're somebody who's an athlete or just active in general, stretching your calf muscle. There's various stretches you can do. That's going to be a big one. Not going barefoot in the home, because when you're barefoot, like I said, it's going to allow some of those joints to be a little more mobile than they really should be. It's going to cause some strain on that plantar fascia.
That one I wouldn't have seen coming, barefoot at home. So when do you know when it's time to see a podiatrist? I mean, some people might be suffering from some ankle soreness or heels.
If you're going a couple weeks and it's just, hey, this is not getting any better. I've tried, just ibuprofen or whatever it may be, maybe ice a little bit. It's just not getting any better. That's going to be the time to see a podiatrist. You can also see your primary care provider at least just to get some initial x-rays. That's usually what happens is they go in, they see their primary care provider. Primary care provider's like, let's send you to podiatry, but we'll get some x-rays. Yeah.
All right, so if that's you, look for more information online right now. You can get that at uofmhealthwest.org. Thank you so much for the time this morning, doctor.
You're welcome.
Appreciate it.